My name is Amol Nergadkar. I'm the CEO of Patient Prism, and we're discussing all things hygiene with Rachel Wall from Inspired Hygien. She's the founder of that wonderful company that helps dental practices all over the country in optimizing their hygiene departments. Rachel's been named one of the most effective dental educators by Dr. Bicuspid.
Thank you.
And she speaks all over the country at various dental conferences. I'm sure you've seen her. My question to you right now is really focused around how important it is for the front desk to be on the same frequency as the hygienist when it comes to, talking about the treatment that the hygienist maybe have diagnosed, or being able to be in tune, right? In tune with what the hygienist's diagnosis and treatment plan was.
Yeah.
So how important are those? How do you do that? And then obviously, how do you get the front desk to be on the same page too?
Yeah, so the first piece of that is team training.
Okay.
So whether it is, you're bringing in CAD/CAM technology,
Sure.
or you're bringing in lasers, or whatever it is that you're doing to improve the practice and the care that you're delivering,
Sure.
everybody on the team really needs to be part of that conversation.
Okay.
And they need to be part of that training to understand why. What is the reason that we're going to focus on, presenting more periotherapy? Why
Okay.
is that? Because otherwise the business team might just think, well, gosh, all of a sudden there's all this, periotherapy coming up. What's going on here? Sometimes they just get curious, or they feel like they've been left out of the loop.
Sure.
So first and foremost, team training is really, really important,
Okay.
so that the business team knows what the clinical team knows and vice
Sure.
versa. Okay. So the second piece of it is that the people that are going to be presenting this to the patient, the business team,
Sure.
they've got to know specifically what the hygienist discussed with the patient. So it's just basic communication. Is how is that handoff? Is it the hygienist kind of escorts the patient up to the front and then says, "Bye, I'll see you next time," and then the business team has no idea what's being presented?
Right. Right.
Or is it, they're just kind of sent up to the front, and maybe there's a treatment plan that is sent as well?
Okay.
Or they go up with the treatment plan, but they don't really know why is the patient being recommended this treatment. So
Sure.
the handoff piece is critical, and it's important for the hygienist to do a personal handoff to really escort the patient to the front, and to say, Beth, I talked with them all, and he's aware that he has some infection in the gums, and I'm concerned because he also has diabetes, and we know that it makes it hard to manage, so
Sure.
he's ready to get started, and this is what we've recommended. Now, even better is if that hygienist is able to give the front desk team some notice that they're going to be presenting this treatment plan.
Sure.
So all of this data gathering and the treatment presentation, all that should start before the hygienist ever starts scaling, so that there's remaining time for the business team or the treatment coordinator to know what the treatment is that's going to be recommended. Now, the hygienist might think, we're going to have the doctor confirm, but
Sure.
again, that can happen earlier on in the appointment. It doesn't
Sure.
have to happen at the very end.
Sure.
And then send that treatment plan somehow, or send some kind of message to the team to say, hey, this is coming up. We'd like
During
for
the
you,
appointment.
Yeah, during
Okay.
that hygiene appointment.
Okay.
We'd like for you to present this to the patient. Okay.
Okay.
So they're prepared. They know what the treatment is. They have time to do the math,
Sure.
right, without the patient standing right there.
Right.
And then the hygienist can hand off and say, here's what we recommended, here's why I'm concerned, and also giving them some sense of the patient's willingness to move forward with treatment.
Sure.
So that conversation is critical.
Right.
I think the other thing is both parties or all parties being open to having a conversation about that. Like, hey, that handoff really worked well.
Perfect.
Let's do more of that. Or, the next time, could you maybe stay a little bit longer? Or, let's have that conversation here where it's a little more private, because obviously HIPAA is always a concern.
Sure.
When we're presenting personal information.
Sure.
Sometimes you can say that, and sometimes you can't. But even just letting the team member know, here's what we recommended and here's what we've discussed.
I mean, the business team needs to be confident when they're presenting, right? Because otherwise, the moment and they're not confident when they don't know enough.
Yep.
And when you don't know enough, you're kind of rushing through it, And the patient's like, maybe I don't, need this, or everybody needs to reinforce the same message.
Exactly.
The front, the back, the middle, everybody needs to talk the same language.
Yep.
How do you train that? How do you? I mean, you've got to be able to go into an office to be able to train these people, right? On the workflow.
Yep.
Do you help with that?
Absolutely, we help with that every week. We're in practices doing exactly that, and a lot of it is practice, right? So we talk about it in concept, right? So here's what this would look like. Okay, now let's practice it, and it's good to practice in a safe environment with your team, right? To do that before, it's showtime and you're with patients. And then to ask, then that's the other thing that we provide at Inspired Hygiene is a lot of continuing support to say, okay, one of the things we worked on was this hygiene to business team handoff. How's that going?
Right.
What are you noticing? Well, I'm noticing that patients have a lot less questions for me at the front because the hygienists have already answered them.
Right.
And I have fewer patients saying, oh, well, I'm thinking, she said something, but then I'm thinking maybe I can just come back for a cleaning.
Right.
So because the patient knows that now the business team knows what treatment that there is that they need.
Absolutely. I mean, and that's going to improve your case acceptance rate significantly because now the moment, and we talked about this a lot at Patient Prism when we talk about the journey of a patient, right? And obviously what we're trying to do in that patient journey is the beginning when they call an office, we want to make sure they get in. And you don't want to create any kind of, so the moment a receptionist seems to be unclear about what's happening, the patient kind of gets fearful that, oh my God, maybe this is not the right place. And that translates into the entire journey of the patient. And when they come in, they see the hygienist and the handoffs. So really important from this segment is to understand that everybody needs to be trained. And everybody needs to be on the same page when it comes to, especially the front desk, when they're checking people out or when they're discussing the treatment plan and what it costs. The handoffs need to be perfect. So
and that business team has to believe in that treatment just as strongly as the hygienist and the dentist believe in it.
That's a great point. I mean, absolutely, because that's going to give the patient the confidence that they're at the right place and everybody is giving them the same message.
Exactly.
So, great segment. Thank you.
Yeah, my pleasure.